Welcome back to Home Base Haven again. I'm back for a second time today. If you didn't see my first video, check on the channel. This one is going to be specifically for my healthcare folks and more specifically for my medical billers and coders. I'm making a video especially for you guys. If you're familiar with my channel, I feature probably majority healthcare roles, especially health tech roles. For those of you that work in that industry, I have worked in healthcare for many, many years, so it's an industry that I know well. That's why I feature so many healthcare roles on this platform, in addition to any other industry you can think of. But I wanted to make one specifically for my medical billers and coders, and that's what I have for you today. It's 3 companies that I'm going to be sharing with you that are currently hiring for several roles, and there's some entry-level options and a senior position that pays 6 figures, and these are of course fully remote. So just wanted to give that quick intro. If you're new here, welcome, and to those of you that are familiar, thanks for coming back. And the newbies, please make sure you grab your free download below to help you with your job search. There are 20 remote job sites on this list. They're all clickable links, easy to use, just a free resource to help you with your job search. All right, let's get to the first company. This is Ensemble Health Partners, and they are in the revenue cycle space, and they're looking for a coding specialist. Actually, if we go to their careers page and if you just type in coding, they have 252 jobs. Let's pause right there. That pop up. Okay, so if you are in between roles or you just need to get your foot in the door somewhere and get started with your coding career, maybe you're newly certified and you really are just looking to find something to start, they have a lot of opportunities and clearly a big need for coders right now, highly in demand. So please look where it's hiring. Ensemble Partners clearly is one of those places, okay? And they have all kinds of coders that you could think of: vascular, forensic, auditors, coding specialists, supervisors, physician coding. There's a director role. So it just goes on and on, Profi, on and on and on. Make sure you go through this list if it's something that you are currently looking for. I'm going to highlight this particular role. This is a coding specialist position. Of course, this requires some experience. This is not particularly entry level as a specialist, but in coding, you're familiar with that, all right? So this is a full-time role, and this was posted not that long ago, and it says it's remote nationwide. And the pay is $19.95 per hour to $22 per hour. And it says the coding specialist position reviews medical record documentation and accurately assigns the ICD-10 CM, ICD-10 PCS, as well as CPT for codes based on the specific record type and abstract specific data elements. You already know that as a coder, right? So you know the typical job responsibilities. They break it down for you more specifically, how they have it outlined for you there. What they're looking for is just 1 year of previous coding experience. So that's pretty good to go into a specialist role, even though it's not the highest paying specialist role. But if you just kind of want to get that title on your resume, and pretty early on, if you have just 1 year of coding experience to jump to a specialist, that's pretty good from what I'm familiar with. And PC and computer application knowledge and experience, so being able to navigate a computer, Excel, Word, PowerPoint, basic programs. Excellent organizational skills, communication, time management, troubleshooting, and problem solving. The ability to multitask, which as a coder you specialize in. And experience with Epic and previous use of coding software tools. If you don't have Epic specific experience, because it can be hard to get Epic experience if you haven't worked for a hospital or healthcare system that uses it, just note any coding software tools that you have used, any EMRs or EHRs that you have used. It still counts because they're going to train you anyway. And if you just have familiarity working those type of programs and navigating through them, then that should be good enough, in my opinion, okay? Just add it on there. It couldn't hurt. The worst they could say is no, and you just apply somewhere else, okay? Minimum education is high school diploma or GED, and of course requires certifications through the AAPC or a HEMA coding certification, and the CPCA, of course the CPC once you've had experience, CCA or this coding specialist certification here. Okay, so that is just one of the many roles that I showed you that Ensemble is hiring for. Take your time and go through this list to see if there's something that you might be more interested in. They also have patient access specialist roles and several of those that have been there for quite a while. So plenty of options to choose from if again, you're just trying to get your foot in the door or you're early in your coding career or healthcare career and you want to work from home, this could be a great company to start with, okay? Next, we're going to look at Elara. This one is for a medical biller role. This is remote within the US, and Elara is a telemedicine platform delivering expert multidisciplinary healthcare for women with hormonal conditions covered by many insurance plans, okay? And it says we're seeking an experienced and highly motivated remote contract medical biller to support our fast-paced billing department operations. This role will be instrumental in managing the end-to-end billing cycle, contributing to our high-performing KPIs, and ensuring excellent patient satisfaction. The ideal candidate is a self-starter who thrives in an independent work environment and can seamlessly integrate into a remote team. And it says, of course, fully remote opportunities are available within the U.S. Specifically, they go more into detail about the specifics of the role. I'll let you read that on your own time if you're interested in applying. Let's go over what you need to be able to apply. A minimum, again, just 1 year of proven experience in end-to-end medical billing and revenue cycle management. Demonstrated ability to work independently, as they mentioned before, critical thinking, problem solving, you must be analytical, great communication, the standard transferable skills that we often talk about, proficiency in using productivity tools like Google Sheets, Excel, experience working effectively within a remote team, and a strong commitment to achieving and exceeding the performance metrics, of course. Okay, and preferred qualifications, if you've worked with Candid Health practice management software, or if you have experience with Elation Health HR, that's a plus, but these are not requirements. And then they have the technical requirements here. And note that this is a 1099 contractor role, up to 40 hours per week. It's $20 per hour, 100% remote, and flexible hours available within our operational needs. Okay, so that's that second company there, Elara. Let's go to the next one. This will be the senior billing specialist role. And if you haven't heard of Maven, it says Maven is the world's largest virtual clinic for women and families on a mission to make healthcare work for all of us. Maven's award-winning digital programs provide clinical, emotional, and financial support all in one platform, spanning fertility and family building, maternity and newborn care, parenting and pediatrics, and menopause and midlife. So they cover a wide range of topics that are specific and applicable to women. And they have many accolades as a growing health tech company, and they've listed them here if you just want to get more familiar with their credibility in the healthcare industry. And in this role, it says you will lead the resolution of complex financial and benefits billing escalations, serving as a key expert to ensure accurate member financial tracking and provide equitable solutions for members, employers, and insurers. They go more into detail about this role. Of course, you're going to investigate and resolve escalated cases involving billing errors, incorrect benefit calculations, overpayments, disputes, things like that, and act as the primary bridge between operations, product and engineering, the various teams that surround the billing process. You're going to reconcile claims data, denial reports, and finance outputs across many platforms, track cases through resolution, and communicate clearly with all team members involved. The requirements here, now it's not required, but they prefer that you have a bachelor's degree in healthcare administration, finance, business, or related field, 3 or more years of relevant experience. Remember, this is a senior role in medical billing, health benefits, or escalation management. The proven ability to handle complex billing escalations, a deep understanding of the claims lifecycle, familiarity with billing systems like EHRs, clearinghouses, things like that. Highly detail-oriented, critical thinker, strong cross-functional collaboration across teams, comfortable adapting to shifting priorities in a fast-paced environment, and you're a creative problem solver. Must have in medical billing. And the salary for this role, you guys, is really great. It's $100,000 to $120K per year. Okay, now they say that this is for, as they do with all of these roles, the candidates in these specific states. However, they're telling you this is the budget that they have, okay? And likely it's going to have to be similar if you live outside of those states. So even if it's a little bit less, it's almost 6-figure role, working from home, a growing health tech company, a senior position, and you can get some really great experience. This is an awesome opportunity if you're looking to level up in your coding career and you haven't yet reached a senior role, or maybe you have, and this is a higher salary than what you're currently receiving. So Just want to put this out there for you guys. That's it for this video. If you liked this type of video, please hit the like button and let me know. Leave me a comment. Where are my healthcare folks? I know you're out there. Talk to me. Let me know you're here. Let me know what kind of roles in healthcare you're looking for so I can better tailor these videos and make more specialized, specific videos for you guys on this channel, mixed in with everything else. And share this with a friend or family member that is looking for these types of roles as well. And I hope you have a great rest of your day. Thank you so much for watching. Make sure you're subscribed and hit the notification bell so you don't miss these leads, and sign up for the email list if you haven't already. They get all of the job leads first dibs, less competition. So thank you again. I hope you have an awesome rest of your evening, and I'll talk to you guys again soon.